Today we will know about FIGO classification for fibroid, its gold standard investigations, clinical features and treatment. Fibroids are most common benign tumors seen in 20 to 40% of reproductive age group women. Most of the time fibroids are asymptomatic, but sometimes patient may get troublesome symptoms like menorrhagia, dysmenorrhea, pressure symptoms and infertility or subfertility. Coming to the FIGO typing or subclassification for fibroid, it is from 0 to 8. Type 0 is submucous pedunculated fibroid in the cavity. Type 1 is less than 50% of the fibroid is intramural and rest of the part is projecting in the cavity. Type 2 is more than 50% of fibroid is intramural but still it is protruding through the cavity. Type 3 and type 4 is intramural fibroid where most of the part of the fibroid is seen in the layers of myometrium, but still it is touching the surface of endometrium. Type 4 is 100% of fibroid is in the layers of myometrium and it is not touching the surface of endometrium. Type 5-6 is subserous fibroid. So coming to the type 5, it is more than 50% of fibroid is intramural and remaining part is projecting on the surface of the uterus which is beneath the layer of serosa. And type 6 is less than 50% of fibroid is in the myometrium, whereas most of the part is protruding through the surface of the uterus beneath the serosa. Type 7 is pedunculated subserous fibroid and type 8 is special type of fibroid such as cervical fibroid, broad ligament fibroid and wandering fibroid. Now coming to the diagnosis, the gold standard for diagnosis of fibroid is good TVS or transvaginal sonography. Then MRI for proper location and depth of fibroid in relation to layers of the uterus and for mapping of the fibroid before surgical evaluation for the patient. Then fibroid can be diagnosed by direct visualization with hysteroscopy for submucous fibroid and laparoscopic visualization for intramural and pedunculated fibroid. Coming to the treatment, it is medical line of management mainly for the symptomatic relief of the patient and surgical line of treatment for removal of the fibroid. Coming to the pharmacotherapeutical management for the fibroid, it is with the drugs like tranexamic acid which help in stabilizing the blood clot. Then GnRH agonist and antagonist that help reducing the level of estrogen and shrinking the fibroid. Then combined oral contraceptive pills also helps in stabilizing the endometrium by thinning the endometrium. Coming to the surgical management, it can be myomectomy, which is hysteroscopic myomectomy for submucous fibroid and laparoscopic myomectomy for intramural and subserous fibroid. For those patients where fertility is no more desired and having severe symptoms not responding to medical line of management, the definitive treatment is hysterectomy where we remove the uterus. Then there can be treatment modalities like uterine artery embolization for those patients who want to conserve the uterus and MRI ablation for fibroid. So for details you may go through the slide for FIGO subclassification, diagnosis, symptoms and treatment of the patient. Thank you.